Hello everyone and welcome to the channel. My name is Sarah and I'm here with iHealth Brokers. Today we're diving into some major developments that could impact millions of Americans, especially retirees. Now, if you're new here, welcome to the channel. Feel free to drop us a comment below and introduce yourself and ask any questions that you may have. And if you're returning, well then we thank you for your continued support. You are the reason that we do what we do. Now there is a lot to unpack in this video, so let's get right to it. On the campaign, President Trump had promised not to touch Medicare, Medicaid, or Social Security. But now that the big beautiful bill has been signed, things have changed. One of the most surprising changes has to do with Medicare eligibility. Even if you were eligible in the past, you may no longer be. Even for those who had paid into Medicare payroll taxes or become eligible through their spouse's work history, if you are not a U.S. citizen or permanent legal resident, you may no longer be eligible for Medicare. That means you won't be able to buy into Medicare Part A, and you may lose access to the Extra Help program, which helps low-income individuals with Medicare costs. These changes will likely impact millions of Americans who had previously qualified for Medicare. Remember that although these changes are not immediate, in the case of Medicare, we're talking about 18 months, it's still very important that you prepare so that when the time comes, you're not left with no choices. There are major restrictions being placed on ACA and Medicaid enrollment. For example, states that choose to offer Medicaid to non-citizens may face penalties or cutting of federal funding. Additionally, if you wish to qualify for a premium tax credit, there is no more grace period. Paperwork must be submitted in advance. Also, the marketplace enrollment window is shrinking from 8 weeks to 6 weeks. It will now be November 1st to December 15th in most states. And unfortunately, marketplace enrollment will no longer be automatic. You will need to manually re-enroll. So it really is more important now more than ever before to make your appointment with your broker in advance, especially because that window to enroll is shrinking. Because of this, we do recommend that you reach out to your broker sooner rather than later. If you'd like our assistance, you can reach us in the comments below or at the number on the screen. We are licensed health insurance brokers and we're licensed nationwide with absolutely no charge for our services. Now, these are just the first of possibly many changes to come to the marketplace in the future. So please make sure to subscribe to stay up to date. And of course, make sure to like this video. We will keep you up to date on all changes regarding marketplace, Medicaid, and Medicare. Changes to Medicaid have also been sweeping and will affect legal residents and citizens alike. States that cover non-citizens now face penalties and may lose federal funding. The federal share of costs for the Medicaid expansion group is dropping from 90% to 80%, shifting billions of dollars into state budgets. States may be forced to reduce Medicaid coverage to make up for the gap. Work requirements are also back. Able-bodied adults aged 19 to 64 must work at least 80 hours per month to qualify. Exemptions only apply to parents of children under 15, disabled individuals, or seniors over age 64. These changes are likely to be controversial, and we respect that people will have very strong opinions, and of course we do invite polite discourse. So if you have strong comments or feelings, please feel free to put them in the comments below, but we do ask that you remain polite in your exchange. Now let's switch gears a little bit and talk about Social Security and clear up some of the confusion there. We had thought that there would be no more taxes on Social Security, but the bill actually did not repeal those Social Security taxes. The Byrd Rule and 1974 Budget Act prevents Social Security tax changes via reconciliation, so a full repeal would have required 60 Senate votes. Instead, the bill offers a temporary $6,000 tax deduction for seniors age 65 and older, but unfortunately this only lasts 3 years through the end of 2027. Still in all, this deduction will help 80 to 90% of seniors, but it's not permanent. People under 65 are not covered, and of course these changes will end come 2028 unless new legislation is passed. So fingers crossed for some good news there in the coming years. While we're discussing Social Security, let's talk about those paper checks that some prefer to receive. So starting on September 30th, if you currently receive a paper check, you must immediately switch to a direct deposit or a Direct Express debit card. Failure to do so may result in missed payments. The exemption process has also been changed. Only the U.S. Treasury, not your local Social Security office, can grant exemptions. To qualify, you must have a severe mental impairment, live in a remote area with no access to electronic banking, or be ineligible for a direct express card due to special circumstances. Unless you're 104 years old or older, you're expected to make the switch. And if you are 104 years old or older, please let us know your secrets in the comments below. So there are good and bad changes. Some of the good changes are not as good as we had hoped. Some of the bad changes are not as bad as we had feared. But you definitely need to be aware of these changes and how they impact you. So to summarize, Medicare is cutting eligibility for non-citizens. Medicaid is shifting costs to states and tightening work rules. Social Security taxes were not repealed, just temporarily reduced. And a new rule may cut off paper check recipients starting September 30th. Change is scary, especially when we're talking about things as important as Medicare, Medicaid, and Social Security. So please, if you have any questions, feel free to reach out to us in the comments below or at the number on the screen. As I said, we are licensed health insurance brokers. There's absolutely no charge for our services. We're licensed nationwide, and we are more than happy to help. Now, in today's video, I really just gave you a brief rundown of the changes that have been enacted. However, if you want to learn more as to how those may impact you, I highly suggest you check out this video over here. And if you want to learn more about Medicare, make sure to check out our All About Medicare playlist or our All About Marketplace playlist for those enrolled in Marketplace plans. Of course, please make sure to like this video so we can get this very important information out there, and make sure to subscribe to stay up to date. We'll see you next time.